we're ready to proceed, and the first step is to gain proper isolation. And my preference is the rubber dam. In my opinion, there is no better way of total isolation than utilizing the rubber dam. I will also isolate the entire quadrant. Even though working on a tooth in the middle of the quadrant, just a single restoration, it makes a lot of sense just to go from the last tooth in the arch up to the midline, and we'll place a bite block to help the patient's muscles so they don't get so tired, and a napkin just for comfort purposes. But by going from the very last tooth up to the midline, and that's the way I do it all the time working on a posterior tooth, it gives us tremendous access, opens everything up for visual and as well as for getting our hands in here. I also have another little trick that I'll be showing, which will increase and improve and give us maximum isolation. Okay, so now we're going to use a close-up because I'd like to illustrate a tip which I feel is extremely important and in fact guarantees 100% isolation. And that tip is to place a ligature around the tooth that's being treated using wax floss. So I'm going through the contacts so that I have the ends on the buckle, is to go twice. That is what's called the surgeon's knot, looping that twice. And now we'll come close up right down onto the tooth. And when I pull this knot tight, and you can see, look what it does. It drops the rubber dam to the bottom of the sulcus. And because I've done the surgeon's knot, it's locked. And then we'll do the double knot, Boy Scout knot, which is one more knot to lock it in place. And we'll cut that knot very short. And so what you have now, looking really close up, is the rubber dam pulled to the bottom of the sulcus, the tissue is on the other side of the dam, we have isolation such that there will be no leakage in the operative site. And what that means is as I go through the adhesive steps, I've got 100% isolation and don't have to worry about the seepage from the sulcular fluid. And it gives me a very high and dry margin, as you can see, gingival margin. Okay, so we're ready to remove the amalgam. Prior to doing that, we'll change our gloves. And the reason for that is the gloves get contaminated as you're working in the mouth. And if we now switch to a clean set of gloves, and since the mouth now is completely isolated with the exception of the teeth, there's no way I can pick up saliva or blood or anything else, bodily fluid on my gloves hands. Now this enables us to touch things off the field without taking contamination from in the mouth to items that are off the field. Nice little method of approach. The amalgam's been removed, the cement base was removed, the caries was removed. This is all hard dentin, not carious, very hard, as you can hear the Explorer. We've got a big undercut here. There was caries underneath this buccal region right here. I've got relatively smooth margins. Any stain and amalgam particles have all been removed. And now we're ready to restore.